Navigating the Genetic Maze, a guide to your genetic test report. We've talked about what genetic testing is and how it works. Let's dive into how to actually interpret the results by looking through some examples together. When you first look at a genetic test report, you'll notice a lot of information on the page. For example, the report might begin with the patient's name, lab details, sample type, ordering provider, and dates collected and tested. All of these are important details for ensuring the test was done properly and that the results are accurate. You'll also see details like the test that was ordered and the clinical indication. The clinical indication is the reason the test was conducted in the first place. This information helps the healthcare provider understand the purpose of the test and how the results will be used to guide medical decisions. Let's take a closer look at how this foundational information fits into the bigger picture of interpreting your test results. When you first receive your genetic test results, what's the first thing you'll likely want to know? For many people, the immediate question is, what does this mean for my health? You'll probably look for whether the results indicate a genetic risk or condition and how this might affect your future. You might see terms like pathogenic, benign, or variant of uncertain significance, sometimes called a VUS. These terms are used to help give the meaning to the genetic variants identified in your test. Understanding these terms can help guide decisions about your healthcare, family planning, or the next steps in managing your health. So let's break down what these terms mean and how they'll help you interpret your test results. In some of our other videos, we have defined what pathogenic, benign, and variant of uncertain significance are. Those words hold weight in terms of how the variant affects the function of the gene. Here you can see the words positive, negative, and VUS. These are the most simplified possibilities of what genetic tests can result in. I say that because each lab is different in how it classifies their results based on their own specific algorithms they have in place to determine the effect of the genetic change. Other terminologies can be used lab to lab, but what you see here is the most common language that is used. Here we have results listed as positive, typically meaning that a pathogenic or disease-causing mutation was found. Negative, meaning a benign, not disease-causing variant was found, or there was no genetic variant found at all. Or a VUS, a variant was found with unknown significance. As seen here, we have pathogenic defined as a positive result that indicates that a specific genetic variant has been identified and is known to be associated with a certain health condition or disease. Variants can be resulted as likely pathogenic, meaning that there is a variant found that is suspected to cause disease based on available evidence, but further confirmation may be needed. We've discussed variants of uncertain significance in our other videos, but to recap, they are when a genetic variant or change has been found, but we don't have enough information to say whether it's harmless, harmful, or if it has any effect at all. This can happen because there isn't enough research on that specific variant, or it may be found in people without health issues. These types of results can return as a positive VUS result or just a VUS, but further interpretation based on clinical information and physician discretion is required for the VUS to be considered and managed as either pathogenic, benign, or remaining a VUS until further testing. VUS, likely pathogenic, and pathogenic results typically return back as positive test results because there was a variant found and it's either been confirmed, suspected, or uncertain for causing disease, and then clinical interpretation is required. Lastly, some results can come back as negative and labeled as likely benign because a variant has been identified, but it's unlikely to affect health. These types of variants are often common genetic variants found within the public. While benign is also a negative result, this is when a variant is found that is well studied enough to be classified as not associated with any health risks. It is considered harmless and not likely to affect the individual's health. Most labs consider results negative when no pathogenic, likely pathogenic, or variants of uncertain significance are identified. And they generally do not report benign or likely benign variants and simply just label the test as negative. When reviewing genetic test results, there's more to consider than just the classification of the mutation itself. Here we can see the gene involved, the associated disease, and the classification of the mutation. However, there are additional key pieces of information that can provide further context. The mode of inheritance, or the inheritance pattern, indicates how the mutation is passed down from one generation to the next. If you're interested in learning more about how mutations are passed down, please check out our video, Navigating the Genetic Maze, What is Passed Down, as we cover various forms of inheritance patterns. Next is zygosity. Remembering that we all should have two copies of every gene, one inherited from our mother and one inherited from our father, the zygosity can tell us whether the mutation is present in one or both copies of the gene. The variant details help to specify the exact location of the mutation on the chromosome and which part of the gene it affects, such as the protein coding region. Finally, the inherited from section helps us determine whether the mutation was inherited from one of the parents, which parent it came from, or if it occurred de novo, meaning it is a new mutation that appeared for the first time in the individual being tested. The example here lists it as being inherited from the father. These types of results are typically seen on whole genome or whole exome sequencing genetic tests, as we like to also take samples from the parents to determine the inheritance or spontaneity of any variant found. This helps us figure out if the mutation is harmful by checking if the symptoms or the variant are also found in one of the parents. With all of this report information in mind, it's essential to recognize the different types of findings that can emerge from these positive test results. These can be broadly categorized into primary findings, including candidate findings, incidental findings, and secondary findings. Each type offers unique insights that can help guide clinical decision-making. Starting with primary findings, or our confirmed diagnosis findings, the primary goal of most genetic tests is to confirm or rule out a specific condition. In this case, the test result is directly related to the reason for testing and can provide a confirmed diagnosis. For example, if a patient presents with symptoms of a genetic disorder, the test result might confirm the presence of a pathogenic variant, establishing a clear link between the genetic variation and the patient's condition. These results are often the most straightforward to interpret because they align directly with the clinical question at hand. Primary results are crucial because they help practitioners identify the genetic basis of the patient's symptoms, which can help guide treatment and management decisions. Think of this like you hear hoofbeats. So you're thinking of horses. So you look for horses. When you can see where the noise is coming from, you see that it is actually coming from horses. Next are our candidate gene findings. These are potential suspect variants. A candidate finding is typically considered a primary finding because it is directly related to the condition or symptoms that prompted the genetic test. However, since its connection to the condition is not yet fully established, it requires further investigation to confirm its relevance. It could also be that the genetic variant might be linked to a disease or characteristic that was not the primary focus of the test, but is known from previous research to still have clinical relevance. Candidate findings often overlap with variants of uncertain significance, but not all variants of uncertain significance are candidate findings. A variant of uncertain significance is a genetic change with unclear health impact. It may be related to the condition, unrelated, or harmless. Well, a candidate finding is a variant of uncertain significance, but it's suspected to be linked to the condition. It just needs more evidence to confirm. In regards to our horse example, you have heard those hoofbeats, so you're looking for horses. You end up finding hoof prints, which, based on your knowledge of horses, is likely to be horses. In some cases, genetic tests may produce results that are completely unrelated to the original reason for testing. These are unanticipated incidental findings. For instance, a test for a genetic condition related to a specific disease may reveal a variant linked to an entirely different condition that the patient wasn't seeking to investigate. These results can sometimes be surprising or even confusing, and their relevance is often unclear at first because they were not expected. These findings require careful interpretation, often with the involvement of genetic counselors or other specialists to understand their significance. For example, if a test was conducted to investigate a patient's suspected neurological disorder, but it also reveals a gene variant associated with an increased risk for cystic fibrosis, this is an incidental finding. It was expected that certain genes might show up and tested, and while it may not be the primary reason for testing, it's still worth investigating further. Even though these findings were not anticipated, they can still be clinically significant. Practitioners need to decide whether to act on this information, especially if it suggests a risk for another condition that could impact the patient's health. Because of this, these results are not automatically reported, but instead based on clinician and lab discretion. Going back to our horse analogy, you hear hoofbeats. You look for horses. But this time, when you hear where the noise is coming from, it's actually a zebra, meaning it could be related to what you were looking for, but unexpected. Other times, it could be an elephant, which is something you were not expecting at all and is a complete surprise. Here we can see an example of an incidental finding on a test report. Remembering that incidental findings are possibly medically relevant findings, but they're not intentionally sought out during the analysis. So if a lab or clinician determines them to be medically relevant, they will either disclose this information to the ordering provider or include the finding in the report. As seen here, it's included in the report. At the top of the report, you can see the section titled Results Relevant to Indication for Testing. These are the primary findings. Under that section, you can see this section titled Other Variants of Medical Significance, and in parentheses, incidental findings. Here, 2 pathogenic variants were found. However, they were associated with conditions that required 2 genetic changes within that variant, and the patient was only found to have 1. This means that the patient was not affected by the condition, but rather carried an affected gene for the condition, otherwise known as being a carrier. Both of the conditions listed here, cystic fibrosis and glycogen storage disease 7, can have serious implications. So these results were considered medically actionable for the patient to receive. These results were listed on the report so the patient and the ordering provider can have this information to consider when discussing family planning and future reproductive decisions. Finally, there are secondary findings, which occur when a test is designed to look not only for the primary condition, but also for other specific conditions or variants that may be relevant to the patient's health. These secondary findings are anticipated because they are actively sought out during testing. If such a variant is found, it may prompt further screening or surveillance for conditions the patient wasn't originally tested for. These findings are important because they can lead to early interventions or preventative measures for conditions that may not have been suspected initially, but are treatable or manageable if detected early enough. Here, we are looking for our horse, but we have also opted in to looking for things that could not be related to the horse, but could affect the environment later on. To discuss secondary findings further, they are a list of 81 genes set by the American College of Medical Genetics and Genomics, the ACMG, that are actionable and associated with adult onset conditions. For example, the ACMG recommends testing for certain conditions like hereditary cancer syndromes, even when the primary test is focused on another condition. The patient has the opportunity to opt in or opt out of receiving these secondary finding results. At most labs, if a child is the patient and the parents are also being tested as a trio, they can only opt in if their child has also opted in for these secondary findings. Secondary findings are only included in whole genome and whole exome sequencing tests. Here we can see an example of a secondary findings report. On the top left, you can see a primary finding, which was a likely pathogenic result fitting the reason for why the patient was tested. While under the primary finding, you can see a secondary finding of a pathogenic BRCA1 gene variant. This BRCA1 gene variant is known for increasing a person's risk for certain breast and ovarian cancers. This patient will now have an answer for their symptoms in the primary finding, as well as the opportunity to have early screening and lifestyle changes for breast and ovarian cancer prevention. The picture on the right and on the bottom provides a much more thorough explanation of what this gene variant is known for and how it can increase the risk for certain cancers, as well as why it is included in the ACMG secondary findings list. Most results will include this information. While secondary findings can be incredibly valuable, if a patient opts into receiving secondary finding information, it's important to consider how their genetic results can be used as well as protected. This brings us to the Genetic Information Non-Discrimination Act, otherwise known as GINA. This is a key federal law that is in place to prevent genetic discrimination. This GINA protects individuals from discrimination based on their genetic information in two key areas: health insurance and employment. This means that employers and health insurers cannot use genetic test results, family history, or even participation in genetic counseling as a basis for making decisions about employment or insurance coverage. This protection applies to genetic information such as the results of genetic tests and family medical history. It ensures that individuals are not penalized for having genetic predispositions to certain conditions, especially when they do not show symptoms or do not have an actual diagnosis yet. However, it's important to note that GINA does not apply to genetic testing for diseases or disorders that have already manifested, meaning that conditions are already showing and present or could be reasonably detected and diagnosed by a healthcare professional. Additionally, GINA does not apply to members of the United States military and businesses with fewer than 15 employees. Understanding GINA is crucial because it ensures that people can access genetic testing and counseling without the fear of being discriminated against by employers or health insurers based on their genetic information. If you do have more questions regarding GINA, you can always reach out to your genetic counselor, find a genetic counselor at the National Society of Genetic Counselors website, or visit the Equal Employment Opportunity Commission website. Understanding these categories helps practitioners and patients navigate the complexity of genetic testing. It ensures that the results are interpreted accurately and that any unexpected findings are addressed appropriately. Whether it's a confirmed diagnosis, an incidental discovery, or secondary finding, each result provides valuable information that can influence clinical decisions and patient care. The key is to consider the clinical context carefully and to work with genetic specialists when needed to make informed decisions about how to proceed. Once a finding has been reported, the interpretation section helps explain the significance of those findings. This section helps healthcare providers understand whether the genetic change is associated with a particular condition, what kind of impact it may have on health, and whether any follow-up testing or medical action is needed. This screen may seem overwhelming, but we wanted to highlight the differences between labs and the way they report their interpretations, as well as how the various testing methods can have different result interpretations as well. Here are some result interpretation examples. As you may be able to see, the interpretation section includes the gene name, details about the conditions or symptoms linked to that gene, and the inheritance patterns associated with the gene. It also defines the gene coverage, which explains how well the test identifies mutations in the gene. These results are specific to the lab that ran the tests and are based on many factors, such as the lab's population data, the frequency of the variant found in healthy people, their own statistical analysis, the functional evidence of the variant that is found in outside published studies, and the clinical fit of the variant to the specific patient. Here we see a negative result, a variant of uncertain significance result, and a pathogenic result example. It should be said that for the negative result, it is stated that even though this specific test resulted in a negative outcome, that does not mean that there is no genetic answer for the clinical symptoms. It's possible that the genetic variant causing the patient's symptoms lies outside of the scope of what this specific test was able to analyze. These are the most generic examples and could be used to represent many different kinds of tests. Looking at the pathogenic result, this result indicates that the variant was associated with the clinical findings, giving us a primary finding, while the variant of uncertain significant result shows a variant in a gene that may be potentially associated with the clinical symptoms, but more information is needed. This could be an example of a candidate gene. In this example, you can see that the first sentence includes a positive and uncertain result, meaning that there was a variant found giving us a positive test result, but it was a variant of uncertain significance. It gives a statement about what this result means for you, stating that a clinician can use this information to make decisions regarding diagnosis and management. It also discusses how these changes can sometimes be found within families and how information can be used to clarify the meaning of this variant further. Lastly, it also discusses what an uncertain result means and how everyone has genetic variations within their DNA, and sometimes they can be harmful, harmless, or just neutral normal changes to you. An uncertain result is one that is not fully understood yet. However, with further research, that uncertain result could be upgraded to harmful or downgraded to harmless or neutral. Here, it's a little blurry, but we can see a positive pathogenic result. The result gives a confirmed diagnosis of hereditary breast and ovarian cancer syndrome because of its association with the variant found in the BRCA2 gene. This test is a cancer panel test that tests for only the genes seen in bold towards the bottom. This report states that no other variants were found from these genes listed, and it then continues to give information about the interpretation of the variant that was found. Specifically here for this diagnosis, there is a risk estimate given because these cancer predisposition genes and conditions do not absolutely confirm a person will or will not have cancer in the future, but rather tells us that they are put at an increased risk for certain cancers that are associated with certain variants in certain genes. The interpretation section here gives a lot of information regarding what the BRCA2 gene does and how, when affected, it can lead to increased cancer risk. This is a carrier screen that tests for variants in certain conditions that require 2 genetic changes to be present for the condition to occur. These are called recessive conditions, and we discussed them in more detail in our inheritance video previously mentioned. In the case of this variant interpretation, we can see that 14 conditions were tested for, and these were a positive result, meaning a pathogenic variant was found in the gene associated with cystic fibrosis. It also says that the patient was a heterozygote, meaning they only had one affected gene, so they are a carrier. In contrast, a homozygote is when both of their genes are affected, which would also make them affected by the condition for this recessive condition. This is the information we discussed earlier in the test report zygosity section. In the case here, this patient is positive for being a carrier for cystic fibrosis. As discussed previously, carrier screening can be helpful when discussing reproductive planning and decisions. Lastly, let's discuss prenatal non-invasive screening. We cover this type of test in more detail in our testing methods video, but to provide a brief overview, this screening is typically performed after 12 weeks of pregnancy to assess the risk of chromosomal conditions. It takes your age and gestation age into consideration, and the primary conditions screened for are trisomy 13, 18, and 21. While this test is not diagnostic, it provides a relatively accurate risk assessment indicating the likelihood that the pregnancy may be affected by one of these conditions. Some labs also test for sex chromosome anomalies, and most will provide a fetal sex prediction. In this case, the screen returned negative results for all 3 conditions and predicted the fetal sex to be female. Based on this information, we can conclude that there is no increased risk for these trisomies and that the pregnancy has about a 99% probability of being female. You can actually see the predicted residual risk being 1 in 10,000 for all 3 conditions. If one of these results had returned positive, that risk would be increased to a specific threshold. For example, the result is a screen positive for Down syndrome in the first trimester. That threshold is going to be at 1 in 230 or greater. Each condition has a different threshold based on patient age and gestational age, but for this example, no increased risk is assumed with 99% accuracy. However, because it is a screen, this is not diagnostic and cannot with 100% certainty be assumed that the pregnancy is not affected. For predictive tests, the results will often include a risk assessment. For example, you might be told that you have a 60% increased risk of developing a condition compared to the general population. This doesn't mean you will definitely develop the condition, just that you have a higher likelihood, which might influence future decisions about monitoring, lifestyle changes, or preventative measures. This type of information is similar to the cancer panel test that we just looked at. There was a positive pathogenic result reported in the BRCA2 gene, stating that the patient now knows they have an increased risk of the cancers associated with the variant found in that gene. Many genetic tests report will include recommendations for follow-up testing, lifestyle modifications, or consultations with specialists. If you test positive for a genetic condition, the report might suggest genetic counseling or even specific screening tests for early detection. As shown here, there are several examples of recommendations based on their specific test results. The first recommendation advises the patient to discuss the results with a genetic counselor and suggests using clinical information to help determine if a diagnosis is appropriate. It also recommends performing genetic testing on the father to determine whether the identified variant was inherited or occurred spontaneously. Additionally, another form of genetic testing is recommended should the patient choose to pursue it. The second recommendation emphasizes the importance of consulting with a genetic counselor, and it also suggests testing other affected family members to see if the variant is present in them, which could help determine if the variant should be classified as pathogenic or benign, or if it should remain a variant of uncertain significance. The final recommendation also includes the necessity of discussing the results with a genetic counselor, while also recommending genetic testing for any family members who may be at risk of carrying the same variant. It further notes that medical management may change due to the pathogenicity of the variant found. These are just a couple examples of the types of recommendations that could be included, but the main point is that the recommendations can be personalized for the patient and their medical management, as well as to help further clarify testing results and interpretations. The additional analysis comments section of a genetic test report provides extra context and insights that may be relevant to understanding the results. This can include information about variant interpretation challenges, family history, or other factors that may influence the significance of the findings. For example, it may mention if the variant has been observed in other family members or if it was seen in additional cases in the medical literature or databases. These comments can also highlight whether further testing or clinical follow-up is recommended or provide clarity on any uncertain or inconclusive results. Essentially, this section helps to guide clinicians in making more informed decisions about diagnosis, treatment, and the next steps. The resources section provides helpful information and references for further understanding the test results. This could include links to genetic counseling services, relevant medical literature, patient support groups, or online databases. These resources help patients, providers, and families understand the implications of the genetic findings and offer support for next steps in healthcare management or decision-making. The methods section details the specific techniques and technologies used to conduct the genetic testing. This could include information about whether next-generation sequencing or microarray was used, as well as the specific approach for analyzing the genes in question. This section helps provide transparency about the testing process, ensuring that the methodology used is appropriate for the condition being studied and that the results are reliable. The quality metrics section provides information on the accuracy and reliability of the genetic test. This might include data on coverage, which is how well the genes were analyzed, read depth, which is how many times a region of the genome was sequenced, and call rate, which is the percentage of variants identified with confidence. It may also mention the sensitivity and specificity of the test. These are metrics that help to assess the robustness of the results and indicate whether the test was performed at an acceptable standard to ensure not only reliable but clinically meaningful conclusions. The disclaimer section provides important legal and medical information regarding the limitations of the genetic test and its results. It often highlights that genetic testing is not definitive and that results should be interpreted within the broader context of a patient's clinical presentation, family history, and other diagnostic information. It may also clarify that not all genetic variants are fully understood, and new research may change how certain variants are classified. Additionally, the disclaimer may mention that the test is not designed to detect every possible genetic condition and that incidental findings may or may not be reported. The references section lists the scientific literature, databases, and other authoritative sources used to support the interpretation of the genetic test results. This could include research studies, clinical guidelines, or publicly available genetic databases like ClinVar or HGMD. By providing these references, the section ensures transparency and allows healthcare providers to access the original sources of information that inform the classification of those genetic variants, and this helps offer additional context or evidence for clinical decision making. Genetic test reports can vary by lab, with different formats and levels of detail, so it's important to focus on the most relevant information for efficiency. Labs may use different nomenclature for naming genetic variants, so it's always a good idea to ask questions if anything is unclear. Methods for classifying variants can differ between labs, and they may apply guidelines like the ACMG standards, which are standards used by labs to classify genetic variants based on evidence, helping to determine whether a variant is likely to cause disease or is benign. This helps labs classify variants based on research, internal data, and expert guidelines. Labs may also use different testing methods, and understanding how to navigate the sections of a genetic test report can make it easier to interpret the results and reduce the feeling of being overwhelmed by complex genetic information. Genetic testing is an exciting and evolving field that can provide valuable insights into your health, family planning, and even your ancestry. But understanding your results is crucial. The results can be emotionally complex, especially if a risk for a serious condition is found. Please make sure to seek expert guidance when interpreting them to make informed decisions about your health and future. If you are looking for genetic counseling or a genetic counselor, or you have a question for a genetic counselor, please use this link to help find a genetic counselor near you.